So I thought I would start with food because it's something that we interface with multiple times a day, and diet has significant impacts on our health. I really like this quote because it highlights the disconnect that currently exists between food and health. There's no connection between food and health. People are fed by the food industry, which pays no attention to health, and are healed by the health industry, which pays no attention to food. So, as I mentioned, diet is a significant contributor to heart conditions such as high blood pressure, coronary artery disease, arrhythmias, or irregular rhythms of the heart, high cholesterol, which portends to heart disease, heart failure, and diabetes. And I like this cartoon because I thought it was entertaining. Everyone knows food is bad for you, but I don't know what else to eat. Which brings us to sort of the standard American diet, which has been the staple of at least middle America for the last 50 to 60 years. This diet is also known as the meat and potato diet or meat and sweet diet. It tends to be high in animal meats and products, and low in whole grains, and low in plant based foods such as vegetables and fruits. Also, this diet tends to be high in processed foods, which also leads to high amounts of added sugars, sodium, saturated, and trans fats. So, what is the problem with SAD? Unfortunately, this diet leads to increased inflammation, increased atherosclerosis or plaque formation, endothelial dysfunction, depression, anxiety, even sleep disturbance, obesity, and diabetes. All right, so what is sort of the antidote to the SAD? Turns out it's it's the Mediterranean diet. So I know when we hear Mediterranean, we tend to think of Italian food, but that's not necessarily the case. So don't don't dive into your pizza and pasta just yet. So when we refer to this diet, it is based on the traditional diet of Crete, which is an island off Greece, and tends to be plant-based and minimally processed. So it's a diet that's high in vegetables and fruits, legumes, nuts, and seeds, 100% whole grains in the form of cereals and breads to a lesser extent. Olive oil is the primary source of fat, with moderate amounts of fish and chicken and much less red meat than we're used to. Yogurt tends to be the main form of dairy, and they tended to have around four or less eggs per week. And moderate alcohol intake occurred with meals. So, what are the benefits of the Mediterranean diet? We have seen decreased health risks and improved outcomes related to cardiovascular health, such as high blood pressure, atherosclerosis, again, plaque formation, with subsequent reduced risk of heart attack and stroke. And as a bonus, you also have reduced death and disease from cancer, asthma and allergies, dementia, even, as well as autoimmune conditions such as rheumatoid arthritis and lupus, and also decreased mortality from diabetes. All right, so I wanted to talk a little bit about alcohol because it probably has been an essential part of many of our lives during this time, with an increase in alcohol intake throughout at least the Bay Area, if not the world. So what are the benefits of alcohol? It turns out that alcoholic beverages may benefit heart health, but in very low doses. And these doses come to around half a drink or serving per day. And I know that many of us have heard about resveratrol, which is an antioxidant polyphenol found in the skin of red grapes. And it may be that resveratrol has some benefits on heart health in multiple domains. But unfortunately, the amounts needed or demonstrated in studies translate to very large amounts of alcohol, anywhere from 5 to 30 glasses a day to get the needed amounts to be beneficial. So that is probably not necessarily a sustainable equation. All right, so what are some of the downsides of alcohol? Well, it's certainly not a diet drink. It amounts to 7 calories per gram, which puts it above carbs and protein and just below fat. And it turns out, as we probably know, that increased drinking is usually associated with increased food intake. In addition, chronic increased intake tends to deplete certain vitamins and minerals and leads to poor sleep and depression as well. And so, what are some of the more significant adverse effects? Well, we see an increased risk for high blood pressure, for cardiomyopathy, which is muscle dysfunction, so heart muscle dysfunction, arrhythmias or irregular rhythms of the heart, and elevated triglycerides, which can lead to fatty accumulation around our organs and also increased heart disease. And alcohol itself is the fourth cause of premature death in the US in a non pandemic year, of course. And it turns out that any amount of alcohol intake is associated with an increased risk of cancer. Interestingly, women, for example, are at increased risk for breast cancer if they have an intake greater than a drink 3 or 4 times a week. All right, so a word about water. I think, we tend to think of water as a luxury provided to us by our employers, and, and maybe that we're having a harder time getting enough fluids at home. But it's really important to get adequate fluids during the day. So in addition to impaired mental and physical function in the immediate period, we also see some longer term effects on heart disease related to increased plasma and blood viscosity or thickness, as well as blood hematocrit. So all of that makes the blood more thick, and the flow can become impaired. In addition, we also see increased levels of clotting factors such as fibrinogen, diminished or decreased endothelial function, increased sympathetic response, that fight or flight response that I discussed earlier. We have diminished orthostatic tolerance. And what that means is that we can't sort of sustain changes in position. So when we get up from a seated position or from a lying position, we might get very dizzy and pass out. And dehydration can lead to impaired blood pressure regulation. And it turns out that increased risk may be more pronounced in women than men.